Hi, I'm Dr. Sai Praveen Harnath from Apollo Hospitals, Hyderabad. I am here today to request you to think about a concept to prevent deep venous thrombosis. What is that? Well, normally blood is flowing from our legs up towards the heart. This is because of the mechanical function of the legs, where the muscles are pumping blood and pushing the blood up, and the blood doesn't fall back down against gravity because of valves. When you're not moving, either because you're hospitalized or you're traveling in a vehicle or an aeroplane, for example, for a long period of time, the blood can actually clot up. If these clots then break loose, they end up in the heart, then they get stuck in the lungs and they can cause severe breathing difficulties, sometimes life-threatening. Preventing these clots is very easy. Sometimes you can give a medication, or sometimes you can also use a device that mechanically pumps the legs and does a little squeezing of both legs, which pushes the blood up. So there are devices called sequential compression devices, which are used in the intensive care unit and in other places in the hospital, which will help the blood to flow up and prevent them from getting clotted. The problem which we face in a practical sense is that these devices need to be cleaned. They can get soiled by urine or feces or stool when a patient is sick in the ICU and don't have control on their bladder and bowel movements, in which case they need to be washed and cleaned and dried. This creates a situation where the devices are taken off, they're getting cleaned, the patient does not have protection during that time. The devices work only as long as they are squeezing continuously. So our suggestion and proposal, which we would like to mentor for your team, is to come up with a self-contained, self-powered device which is applied on the legs to continuously pump and push the blood up so that it is not stopping, and also make sure that these can be cleaned quickly, or they are so low cost that they are disposable, and also are antimicrobial, are hydrophobic, and are low cost and can be made in India. The current devices which are available are not practical in many ways, and many patients have difficulty wearing them. They're sometimes not comfortable. So my proposal is to kind of come up with you and mentor you to create a device which is what I would call reliable, cost-effective, sleek, self-powered, user-friendly, indigenous, a reusable, mechanical, tightly fitting device with hydrophobic material, antimicrobial features, and with easy cleaning ability. This will prevent blood clots, and this will allow that the cost is low. It'll allow you to actually make sure that there's no frequent interruption. So it'll be great to work with all of you, and we'll be glad to mentor you. This again is Dr. Sai Praveen Harnath, requesting you to come up with a device to prevent DVT or deep venous thrombosis using a simple solution of a mechanized device. Thank you.